At the peak of the COVID-19 pandemic in New Jersey, Hackensack University Medical Center rushed to stand up a distinct plasma study of its own, zeroing in on donors with the most potent antibodies. It began April 4th, and we joined them just days later to witness their breakneck battle against this deadly disease with the promise of plasma. Medical oncologist Michelle Donato, the principal investigator of the therapeutic study, is armed with an arsenal of donated blood plasma, loaded with potent antibodies.
We have to find a solution. I think we're just a piece of that puzzle.
Until we have an effective vaccine, we're going to take the position that we need drugs. And right now, our best drug is the one that's manufactured by those patients and those individuals who've recovered from this disease.
Welcome back to Face the Nation. Robert Garrett is the CEO of Hackensack Meridian Health, the largest health network in New Jersey. His group will receive the Pfizer vaccine. New Jersey has been hit very hard by COVID-19.
As we speak this morning, we are taking care of about 900 COVID-19 patients. We've seen over 22,000 patients since the beginning of the pandemic. We are really excited about making history here as we start to vaccinate the American people. I truly believe this is going to be the beginning of the end of this terrible pandemic.
Can you give us sort of an idea as to when we might start to see a vaccination and inoculation rollout in New Jersey?
We could hear as early as later today or tomorrow that an emergency use authorization will be given by the FDA so that the Pfizer vaccine can start to be shipped to pre-disposed locations.
How many doses have you received at your hospitals? Are you still waiting on more? And where are you in vaccinating and inoculating your frontline staff?
We started last Tuesday. We have now vaccinated 2,000 of our team members and our physicians.
And we are sharing the story of a truly life-changing procedure.
That's right. It's a non-invasive treatment for folks who are living with essential tremor and Parkinson's.
This new treatment has no incisions, no radiation. Instead, it's an ultrasound that can change someone's life in a matter of hours. Since his early 20s, Bob has lived with essential tremor, a condition that has only grown worse over the last 50 years.
Oh, I can't wait to get this hand fixed.
Dr. Hooman Azmi is using the technology to deliver sound waves without surgery, without incisions, through Bob's skull to his brain.
And when the sound waves coalesce on one spot, they disrupt the cells and disrupt the circuits that are responsible for tremors.
My hand still doesn't shake. It's fine.
Bob's right hand has been tremor-free for 2 years now, thanks to something called high-intensity focused ultrasound.
How much does it amaze you that in just such a short period of time, you can have such a dramatic change in your life?
Oh, it's so amazing. It's unbelievable, really.
Bob, great to have you back with us again. Thank you for that gift.
And that's when the MRI revealed that I had, like 30 seconds to live.
Jeannie had a brain tumor. And in what felt like moments, Jeannie and I found ourselves here in the office of Dr. Joshua Betterson, head of neurosurgery at Mount Sinai Hospital in New York City.
This instantly became clear this was a very high-stakes situation for you, because this is what I first saw, which is a huge tumor.
Right, I recently visited the Mount Sinai Institute for Next Generation Healthcare. It's here in New York, and we got an exclusive look at what they're calling Lab 100. It's a place that promises to revolutionize your healthcare, including a thorough review of my pre-submitted medical history. This is your life.
This is your life. The writing is literally on the wall. Join me in the future of healthcare?
Yes, I am ready.
This is our 3D body surface scanner.
Okay.
It's a scale, it's a turntable, and there's a camera embedded in here.
Sounds fun. A 3D scan captures thousands of measurements from waist circumference to bicep girth.
The goal is that you'll walk out of here with an actionable plan. Blood draw. Wow, this is great. The point is to give our patients visibility into their own health.
Now, how hospitals are preparing for possible Ebola cases in this country.
Well, I think you need to sort that out.
On Wednesday afternoon, staff was buzzing at the Mount Sinai Hospital on Manhattan's Upper East Side. In a special ward, doctors, nurses, and security were prepping at top speed for a dreaded scenario: someone with Ebola walking through their doors. Dr. David Rich is the hospital's president.
So you've been at this hospital for 30 years. Have you seen anything like this before?
There's really nothing like this that's ever been dealt with at this hospital before.
Mount Sinai is a top-notch hospital, but Ebola represents a whole new challenge.
Creating a team that is confident and confident in their skills to care for a patient with this deadly disease that provides extreme risk to healthcare workers, that is the real challenge for us.
Dr. Kenneth Davis heads the entire Mount Sinai system.
Let's remember, there is one case in New York, there are less than a handful of cases in the United States, and the cases are, by and large, healthcare workers.
This is Eyewitness News up close.
Plus, later this morning, Obamacare. Millions more Americans have health coverage than ever before. It is saving billions. But many of us are also now paying higher deductibles and higher premiums. So what's the future of medical care for all of us? This morning, we asked the head of one of New York City's biggest and most prestigious hospitals.
Joining us this morning, Dr. Ken Davis. He is CEO of the Mount Sinai Health System, which is Mount Sinai Hospital and all the other hospitals you've acquired over the years, right?
And 7 other hospitals and hundreds of ambulatory facilities. And a big system and a medical school. Access is a good thing. Have we improved quality? Yes, there are a number of metrics that show that.
Joining us now is Dr. Ken Davis, President and CEO of the Mount Sinai Health System.
It's a complicated bill, and there are really 3 ways to think about it. You think about what it does to access, what it does for prevention and wellness, and what it does for the cost of care.